All right. Thank you for joining us for our monthly webinar series. We're very excited to have Kristina Marusic with us this evening. She'll be talking about the research that she did 2 years worth for her article, Fractured, the Body Burden of Living Near Fracking. I want you to take note that our next webinar will be on October 18th. That's Clean Air and Asthma, presented by Dr. Steph Lee. If you have questions during the webinar, please put them in the chat, or you can use the Q&A function. Feel free to add comments to the chat. We'll monitor that and make sure that we're paying attention. Now I'm going to let Kristina kick it off. Thank you for being here.
Yeah, thank you so much for inviting me. I'm happy to be here. So I'm here today to talk about my 4-part investigative series on fracking and health, which was published by Environmental Health News on March 1st. The investigation took about 2 years. The name of the series is Fractured, the Body Burden of Living Near Fracking. And if you haven't read it yet, you can find the full 4-part series at ehn.org/fractured. A little more about myself. I'm the Pittsburgh reporter for Environmental Health News, where I've been since 2018. I cover environmental health and justice in Western Pennsylvania. And before joining Environmental Health News, I was a freelancer. So I covered issues related to health and the environment, and also politics and gender equality and LGBTQ issues for a bunch of outlets, both locally and nationally. I'm also the co-founder and president of the Pittsburgh chapter of the Association of LGBTQ Journalists. And I'm currently working on a book. The working title is The New War on Cancer, and it's about initiatives aimed at reducing toxic exposures on a wide scale, to be published by Island Press sometime in 2023. I also wanted to tell you a little bit more about Environmental Health News. So we're a national nonprofit media organization. We were founded in 2002 by a scientist named Pete Myers. He was the co-author of a book called Our Stolen Future, which was one of the first public awareness moments for the risks associated with endocrine disrupting chemicals. So he realized at that time that the scientific and research community had a lot of awareness about things like endocrine disrupting chemicals, but regular people did not, and that seemed like a problem. So he founded Environmental Health News with the mission of increasing scientific literacy around environmental health among the general public. We do that through both newsletters that curate news from around the world related to environmental health and the science of environmental health, and through original reporting like mine. We're also hoping to open additional regional reporting bureaus. So Pittsburgh is the first. The idea is that regional reporters cover issues of importance locally related to environmental health with this kind of national and global scientific lens. Pittsburgh is the first of those regional reporting bureaus, and I am the Pittsburgh Bureau. So we have room for growth there. A bit more background on the reporting I've done that's relevant to the work you all do, and also how I got here. So in 2019, I wrote a 5-part series on cancer and environmental exposures in Pittsburgh and Southwest Pennsylvania. And these are just some of the stories that came out of that project. And the book I mentioned that I'm working on came out of this reporting. It won a few awards, which caught the attention of an editor at Island Press. And she reached out to ask if I'd be interested in expanding this reporting into a book with national reach. I've also reported extensively on air pollution in Southwest Pennsylvania, especially from major point sources. And these are some examples of that reporting. Depending which part of Pennsylvania you're from, you may or may not be aware that Southwest Pennsylvania has ongoing problems with air quality and air pollution, specifically from some of these legacy US steel plants and other industrial facilities. I've also been reporting on fracking since I started in this position for about 3 years, often focusing on emerging research related to fracking and health. So here are some examples of that reporting. But I noticed in the course of this reporting that while there are lots of studies showing health issues in people living close to fracking wells, there's very little published research on whether chemicals used in the fracking process are making their way into people's bodies. And Environmental Health News's executive director, Douglas Fisher, started out as a journalist and had done a study as a reporter in the Bay Area about 15 years ago, looking at flame retardants in people's bodies that had a big impact. His reporting on that contributed to California's major regulatory overhaul concerning flame retardant chemicals and requirements to have them in things like furniture and carpeting. So we thought it would be valuable to do something similar with fracking chemicals. We were aware going into it that it's a more complicated question than the flame retardants because those chemicals are less widely used than the types of chemicals that are used during fracking. So to start out, I looked for other studies that had attempted to do this and could only find two. So I found one that looked at farmers in Pavilion, Wyoming, and one that looked at pregnant women in Canada to actually do urine tests or blood tests and see whether fracking chemicals are getting into people's bodies. So this had never been done in Pennsylvania. So since I was out of my wheelhouse and an investigative reporter and not a scientist, to start out, I enlisted help from a whole bunch of scientific advisors to design a study protocol. And this technically qualified as human subjects research. So I also went through an independent review board to make sure we were ethically compliant and that we did everything in an ethical way. And then I collected a total of 69 urine samples, 39 air samples, and 13 water samples from 5 families in southwestern Pennsylvania who over an 8-week period during the summer of 2019. So 3 of those families were in Washington County and lived within 2 miles of lots of fracking wells. And 2 of the families were in Westmoreland County, at least 5 miles away from the nearest fracking well. And Washington County is one of the most heavily fracked counties in Pennsylvania. Westmoreland County is kind of more suburban, fewer fracking wells, but the industry still has a presence there. I took multiple urine samples from each person who participated in the study on different dates. Emissions from fracking wells tend to be sporadic. And so we wanted to get a better sense of what exposure looked like over a period of time, as opposed to just capturing a single day. And I used active wearable air monitors that had a pump that simulate breathing that people wore for, I think, a 6 to 8 hour period on the same day that we collected the urine samples. So that we would have a sense of whether exposures we were seeing in their urine were related to what they were breathing through the air. For the water samples, I collected samples from 3 places in each household, the kitchen tap, the bathtub, and an outdoor hose. I had all of those samples analyzed by researchers at the University of Missouri, who looked for 40 of the chemicals that are most commonly found in emissions from fracking sites and their metabolites in urine. And that list of 40 chemicals we developed by looking at existing scientific literature and studies that had done air monitoring, specifically near fracking sites, to see which chemicals were found most frequently. What I found, so I looked at biomarkers or metabolites for chemicals in the urine samples, and those are the compounds that the body forms after being exposed to various chemicals. The chemicals that are emitted from fracking sites, many of them are kind of ubiquitous, things like benzene and toluene that are pretty nasty and have unpleasant health effects, but are also found lots of places, including emissions from a car and secondhand cigarette smoke. So I also wanted to compare what the levels I was seeing in the families I tested was similar to or different from what we're kind of all exposed to just by virtue of living in the world and going about our days. And the CDC has published data on the levels of some of these same biomarkers that I looked at through the National Health and Nutrition Examination Survey, or NHANES. So comparing our numbers against those, I found that the families in southwestern Pennsylvania had significantly higher than average levels of many of these compounds. For example, all 20 people in this study exceeded not only the average, but also the 95th percentile, or the level that 95% of Americans fall below, for mandelic acid, which is a biomarker for ethylbenzene and styrene. I also found chemicals in water, air, and urine samples that are linked to a wide range of negative health effects, including endocrine disruption, organ damage, and increased cancer risk. I found cancer-causing chemicals like benzene, ethylbenzene, and toluene in the air monitoring samples at levels that exceeded recommended safety thresholds. And I found metabolites for harmful chemicals in the bodies of southwestern Pennsylvania at levels significantly higher than those that are seen in the average American. We're still working on some additional statistical analysis, but early analysis found that families that lived closer to fracking wells had higher levels of certain compounds in their urine than families that lived further away. And those specific compounds are linked to health issues, including skin, eye, and respiratory issues, gastrointestinal illness, liver problems, neurological issues, immune system and kidney damage, developmental issues, hormone disruption, and increased cancer risk. And the families we tested had complained of things like gastrointestinal issues and eye irritation, skin irritation. It's also worth noting that of those two studies I mentioned, one in Pavilion, Wyoming, and one in Canada that looked at whether fracking chemicals are getting into people's bodies, neither included children. So as far as I know, no other study has looked for evidence of exposure to fracking chemicals in children who live near fracking wells. So I included all 5 of the families in my study had at least one child, and some of the things we found were most striking in the children we looked at. So, for example, the highest level of mandelic acid we saw in the study was in a 13-year-old boy. His level was 55 times as high as the national average and almost 17 times as high as the 95th percentile. I also looked at hippuric acid, which is a biomarker for toluene, and the highest level I saw was in a 9-year-old boy whose level was more than 91 times as high as the national average. In several of the children that we tested, we found that their biomarkers for carcinogens like benzene were higher than levels that are seen in the average American cigarette smoker. And we did not include any households that included smokers in the study. So as part of my reporting, I made a public dashboard with charts for each of the families and the biomarkers that had data in NHANES to compare their levels to. So this chart is for one of the families, the Bauer Bjornsons. These were their levels of mandelic acid, which is a biomarker for ethylbenzene and styrene. As you can see, they were all substantially higher than the US median, and also they were all higher than the US 95th percentile. Those first 2 columns with the red and the blue dots represent mom and dad. The names that correspond to the colors are below, and then the 4 squares after are the levels for their kids. This was another family. The first column is Jane Worthington, and the second 2 columns are her 2 grandchildren. These were their levels of transmuconic acid, which is a biomarker for benzene. And as you can see again, substantially higher than the US median, and in several instances, substantially higher than the US 95th percentile as well. So while I did some interesting science here, and there's a lot that's worth digging into further in the data, I also want to note that my reporting for these stories is really centered around the stories of these 5 families. I spent a lot of time with them throughout the course of the study, and I grew to really care about them. One family, the Bauer Bjornsons, who are pictured in the top left, talked about how radically their quiet, idyllic, rural lifestyle was transformed after fracking moved in and what that loss was like for them. Another family, Jane Worthington and her grandkids, who are right there in the center, talked about the mental health struggles that came along with dealing with the impacts of the industry. So one of the kids got sick, and they spoke out about it because they were afraid it was related to fracking. And there was a lot of backlash within their community where a lot of people either worked for the industry or had leased their mineral rights. So they had instances where they were shouted down during a town hall, and the kid was kind of bullied at school. They ended up feeling really alienated in their community as a result of all this. Brian Latkinich, who's pictured on the bottom left with his son Ryan, talked about the loss of his family farm after fracking wells that he allowed to be drilled on his property resulted in contaminated water and contaminated soil. And the last story in the 4-part series profiles 2 activists with a local advocacy group called Protect PT, stands for Protect Penn Trafford. They've been fighting to keep fracking out of their neighborhood for several years, but through the course of our study learned that they're still being exposed to some of these harmful chemicals, and they do have fracking wells nearby, but not as close as some of the families in Washington County. That's Jillian Graber and Ann LeCoyer, who are pictured there in the 2 pictures on the right-hand side. And if you're short on time to read the stories in the series is quite long. There's also a short video featuring the families telling their stories in each piece, so it's worth at least watching those videos. Since we published in March, a whole lot has happened. So we got a good amount of local, national, and international media coverage of the study itself. And here's a quick list of who reported on the study. There's also been some legislative and community action. So a group of 35 Pennsylvania lawmakers wrote a public letter urging Governor Tom Wolf to take immediate action in response to ongoing harm from fracking, and specifically called on the Pennsylvania Department of Health to use the same methods that I developed for my study on a more wide-scale basis to see if more Pennsylvanians are experiencing these kinds of exposures. The Southwest Pennsylvania Environmental Health Project called for additional research using the same methodology used in Fractured as well. And community groups from Argentina to New Jersey reached out to let us know they were citing our findings in their campaigns to protect families in their communities who live near fracking wells. I've also done some important follow-ups since the piece initially published. So I reached out to politicians throughout Pennsylvania from the municipal level all the way up through Governor Wolf's office to kind of summarize what the study found and ask what they planned to do to ensure that the health of Pennsylvanians who live near fracking wells is protected. And then I publicly documented their responses. So if you go to look at the series at ehn.org/fractured, down toward the end of the page, there's a follow-up piece that documents the response we got from we reached out to, I had help from interns, thankfully, about 30 politicians and meticulously documented all of their responses. We also paired their responses with their contact information. So if you want to look and see where your legislator landed and then reach out to ask them rethink rethink their statements about that, or follow up to see if they took the actions they said they would. Their social media handles and their email addresses or phone numbers are all published alongside their responses. I also published a document that helps community groups develop talking points and report highlights from the series for letters to the editor and outreach to policymakers. That can also be found if you're interested in doing your own follow-up. That can also be found on that main Fractured landing page. And a few months after the series came out, I followed up with each of the families to ask how they've been using the findings to advocate for their health and talk about their hopes for the future now that the series is out there. We hope next to publish something peer-reviewed. That process is time-consuming and difficult. If you are or know a statistician who would be excited to help out with something like this, I would love to hear from you. But so right now, the study is not peer-reviewed. We got our results and published my reporting, and the hope now is to pursue publication in a peer-reviewed journal sometime in the next year or so. I've also been sharing my methodology with other researchers in the hopes that the study will be replicated. It was a very small pilot study, so I hope that a university or a research institution with more resources than just me going out and collecting urine samples all by myself will take this up and do similar research on a much broader scale. So I'm being very open and happy to share all the information I can with those folks. I've also chatted with a few, this doesn't have a bullet point on there, but I've chatted with a few lawmakers who are interested in putting out bills that would require this kind of testing at a statewide level about what that might look like, and how to strategically put something like that forward. Each week, Environmental Health News publishes a Pittsburgh Environmental Health newsletter. You can subscribe to that here. If you're not already getting any environmental health newsletters, they're all available through ehn.org. There's a newsletter drop down. There's a daily newsletter that goes out related to environmental health called Above the Fold. And then there are some weekly or daily newsletters related to specific topics like COVID-19 and environmental health, or we have a children's health newsletter, for example. And those can all be found at ehn.org. I'd be happy to hear from anybody watching. If you have follow-up questions or tips for future reporting, this is my email address. And with that, I will wrap up and open for questions.
Thank you, Kristina. Again, everyone, please feel free to put questions into the chat, or if you want to raise your hand, I'm happy to unmute you if you're unable to do so yourself. I had a quick question. You mentioned that the CDC puts out a national report on human exposure to environmental chemicals, I believe. Do you know how often they might update that report?
That's a good question. So in addition to environmental exposures, it's the National Health and Nutrition Survey. So I know that a lot of studies looking at health and nutrition use it too. They ask participants for a lot of information about their dietary choices. I know because I interviewed a researcher who used it to look at PFAS exposure in people who were eating microwave popcorn. So it's a really extensive data set. I think this data set we were using was from 2017, which was the most recently available data set at the time. So I don't know exactly, but it's not every year. It's every 4 or 5 years, something like that.
Okay, thank you. We do have another question from Becky Bernhardt. Were any of the chemicals you studied in your fracking study PFAS?
We did not look at PFAS in the study because we set out to do the study before it was discovered that was it EPA, had approved PFAS for use in fracking. So that news wasn't out yet, so we did not look at PFAS.
Thank you. Other questions out there?
I also had a question regarding like the biomarkers, because you said there's not much studies on children. So are these biomarkers based on adults or just adults or children as well?
So the NHANES data does break it down by age bracket. So generally, I just used the full data set. So when I was saying like the level in an average American, that included adults and children. And I want to clarify that there's not research on fracking chemicals in children's body, but the NHANES data set does include children. So in a couple of instances, I separated it out and said, you know, this 9-year-old had this level compared to the level seen in 9 to 11-year-olds nationally. But for those primary charts and the kind of main comparisons, I just used the national average that includes adults and children for all of those comparisons.
Thank you. Another question from Walter Sue. Well, he has several questions. Given the results, he's surprised more residents aren't equally concerned and want to demand testing. Also, do you think this study can turn the tide against fracking?
So I did hear from a number of people who live near fracking and saw the study and wanted similar testing, including a group of people in Ohio, people from other states who are really interested in getting this kind of testing. And unfortunately, it was sad to tell people no, because people are, you know, they feel that they're facing these exposures, and then they're kind of often told that they're imagining it or treated like they're crazy for feeling like their families are getting sick or worrying about what's in the air. So it was heartbreaking to have to tell people, you know, that we had exhausted our budget and didn't have the capacity to offer testing to everyone who wanted it. There are a few, there's like a specific lab in California, I can't remember the name, but I could get it for you if you're interested, that will run a panel that looks for VOCs, a lot of which overlapped with the list of chemicals we looked for. A doctor has to order it, but I did point, and I haven't used it. I can't speak to the, you know, efficacy of it or anything, but I found out about it because a physician reached out to me in response to the series and said, you should have this on your radar. You should know that doctors can order this panel through this specific lab that looks for exposure to VOCs like benzene, toluene. So that might be a useful tool, and I tried to let people know that was available if they could have their doctor order that with a blood sample or a urine sample. And in terms of turning the tide, that is a big question. I've been reporting on this for just long enough to see study after study after study come out, and this kind of mounting pile of evidence that fracking is harmful to people's health. And it's just kind of astonishing when I reached out to all of these lawmakers who I contacted about the series, how little of an impact it has on specifically generally Republican lawmakers in districts that have a lot of fracking. I understand that there are financial incentives, but it was disheartening to get some of these responses, especially from politicians who just kind of dismissed it out of hand and said the industry is great, we love the industry, we don't take your research seriously, please stop bothering us. So I hope that it is enough to make a difference, but it's we have there's a lot of willful ignorance on the part of people who don't want to consider the potential health harms of the industry.
Along the lines of the first part of that question, you mentioned that the budget didn't allow to add extra families to the study. if we were interested, or anyone on this webinar were interested in replicating this study, approximately how much would you say you would need to budget per family to get the same amount of data?
So we spent around $60,000 on the study,
Okay.
which didn't cover my time. My salary was separate from that, but it covered the cost of the laboratory analysis and the shipping of the samples, and what else got expensive? Materials. I had to purchase, very specific vials for collection to make sure that we weren't contaminating the samples with VOCs. We couldn't use plastic, we had to use glass vials. They had to be shipped on dry ice, and they have to be overnighted, so the shipping component is a little expensive. We did work with a university lab which brought the cost down considerably, and we're a nonprofit newsroom, so they gave us a bit of a discount too. I don't know what it would look like if you were to try and use a commercial lab, and I doubt, right, I'm hedging all of this, but it would be hard to do it less expensively than the version that we did, where it was really just me and the Environmental Health Project of Southwestern Pennsylvania very generously lent me their summer intern, who ran around and held boxes and scribbled down times on a clipboard and helped me with some of the logistical parts of this.
Thank you. Walter Sue also asked, why didn't the Pittsburgh Post-Gazette not publish your study? It seems a glaring miss for the newspaper.
I don't know the answer to that. The media landscape is always a little tricky. Coming from a nonprofit newsroom, we do lots of collaborations, and other nonprofit newsrooms in the area picked up the story. And sometimes at for-profit newsrooms like the Pittsburgh Post-Gazette, there's a little bit more of like an old school kind of competitive thing, as opposed to collaborative spirit. So I have no idea if that's what actually happened there, but if I had to guess, yeah, that might be related. I did, they received the press release and were made aware of the series, but opted not to pick it up.
Thank you. Any other questions for Kristina? All right. Thank you so much. Oh, looks like we have one more. Oh, it says, I use the acronym FMG, fracked methane gas, instead of liquid natural gas, LNG.
Yep. Makes sense to me.
All right. Well, thank you for your time, Kristina. I really appreciate it. I feel like we'll definitely be hearing more from you. We spoke about some other projects that you have going on. So I hope we have you back in the spring to talk about climate and mental health. We do have another question, actually. Do you know of other labs other than the one in California that test for environmental exposures?
I don't, which doesn't mean that they don't exist, but that's the only one that has kind of come on my radar. Part of the reason we partnered with the lab at the University of Missouri is because they did the analysis for that Wyoming study I mentioned that looked at farmers who live near fracking wells. And the scientist who led the laboratory analysis, Dr. Chung-Ho Lin at the University of Missouri, actually developed new methodology for screening urine samples for these chemicals for that Wyoming study that allows for a lot more accuracy than other methods. So we knew that he had done that work for the Wyoming study, and when we first connected with him, he also said he essentially developed it for that study as like a proof of concept and was really eager to use it again. So he was excited for an opportunity to use it again in a similar project. So as far as I know, he's the only person doing it exactly the way that we did it. But I would imagine that there are other labs that can analyze urine or blood samples for VOCs to some degree.
I will just add to that. If you go to our website, psrpa.org, and look at our blogs, we do have a recent interview with Dusty Horwit, who did a report on PFAS, and he does list a couple of places that do testing. These labs are in different locations across the country. Whether or not they do this, I do not know, but it would be worth taking a look if you had questions about that.
And I just want to reiterate that if anyone has interest in doing something similar to what we did, very much an open book. So please reach out. I'd be happy to share more information about the lab or put you in touch with some of the scientists who helped me with this, or give you a copy of our study protocol, or do anything else I can to help facilitate that.
I think we have one more question. Let's see. Are there key legislators at the state level that we should focus on contacting and putting pressure on regarding these issues from Donna McKee?
That's a great question. And it's a tough one because the legislature is still Republican controlled in a way that means it's really tough for yeah, I hate to speak about it in such partisan terms, but in Pennsylvania, it just falls really clearly along party lines that the Democrats who are concerned about the health harms of fracking are a very clear list, and the Republicans who block every initiative they bring to the table to try and address the problem are also a very clear list, and there's very little wiggle room. There's very little jumping ship that happens. So Governor Wolf's office did respond to the study, and they sent a couple of pretty general statements in response to it, just saying, you know, we care about the health of all Pennsylvanians. But I think that if there are specific concerns, it's worth reaching out to the Attorney General's office, specific cases and instances, because the Attorney General's office is still in the process of bringing criminal charges against a number of fracking companies in Pennsylvania over issues related to water contamination and sickening residents. So they're very much still open to hearing about specific cases. And I think it can never hurt for the governor's office and the Department of Health to hear from additional physicians who are concerned about this issue. Apart from that, I would say it's probably good to focus on your actual policymakers. So find out what the people who represent you, where they stand on this issue. You have a lot more leverage with policymakers who depend on you for votes. Yeah, and then you could look to that list of politicians I reached out to also to see if your specific lawmaker responded about the study. And if they did, and you're displeased with their response, I think that is a perfect, you could have a lot more leverage reaching out to someone like that than someone who's in a different district.
We have one other question. This will be our last. Is there a reporter like you in Texas? And I'll add to that, any other news networks such as yours in Texas?
That's a good question. I know there are some reporters doing a really good job of covering issues related to fracking in Texas. I might have to get back to you on names, but when I was researching for my reporting, I included references to, you know, the reporting is very much about Pennsylvania and what's happening in Pennsylvania, but what's happening in Pennsylvania is just an example of what's happening across the United States in fracking communities. So wherever possible, I also pulled in examples of where similar things have happened in Texas and where similar things have happened in Colorado or Wyoming. And I know that when I was looking for information on Texas. I read a couple of reports that were really striking. I wish I could, I could like email you afterwards and follow up with names, but I'm thinking of a specific project I sat in at the Society of Environmental Journalists Convention in Fort Collins, Colorado, which I think was the last one they had before the pandemic. So it would have been 2019. I went to a session on following the money, and it was a group of reporters in Texas who were specifically reporting on the oil fields. So they weren't doing like a health study like I did, but they were doing like really forensic level reporting on corporate money and politics, and just this really impressive work looking at kind of corruption and how industry money influences politics in Texas. So that's not exactly what you asked for, but there are definitely reporters doing a great job covering the industry in Texas.
Thank you again. And thank you for sharing your research with us, and also for offering to be a resource for other people that may want to do similar studies. I myself may take you up on that. And we hope to have you back in the spring.
Thank you so much. It's been really great talking with you all.
Good evening, everyone.